Can you hear me now? There we go. All right. Our next presenter is going to be Dr. Zapata. He's a jack of all trades. Dr. Zapata graduated from Western University, got his doctorate at the University of Lynchburg, and completed an emergency medicine fellowship residency at Arrowhead Regional Medical Center. Currently, he's an emergency medicine PA, emergency medicine fellowship faculty, behavioral health PA, and also practice in correctional medicine. In addition to his job as a PA, he's a research fellow at Cal Baptist University, where he is also a professor. He's an adjunct professor and tutor at UOB and Western University. He has also published a few articles in AAPA, JAAPA, and Clinical Advisor, and presented at multiple locals and national conferences. For all of those, and like me, that think that he probably has no time to do anything else, he's also an ultra marathon runner and a Spartan race enthusiast. Dr. Zapata, go ahead and take it over.
Wonderful. Good morning. How are you guys doing? Good. Can you hear me okay? Excellent. Okay. So I have a little PowerPoint for you guys. I'll pull it up. It's not, too content heavy, but it's just to guide our discussion for today. So let me pull that up for you here. All right. Are you guys able to see the screen? Wonderful. So thank you, Ray, for that wonderful introduction. Ray is one of my students who I have the absolute pleasure to work with. I am so proud of everything that ULB has done. I don't know how much of the context you guys know, but Ray and his classmates have really gone above and beyond to prove themselves on the statewide stage, and I think that's truly admirable. And so very proud of them, very proud to be here with you guys today to get to chat with you about this topic. So just a quick introduction. Thank you, Rick, for the introduction. Yes, graduated from Western U, then went into my ER fellowship at Arrowhead. And you can see this is my buddies from Western U, went over to the fellowship to finish in emergency medicine and critical care. And so one of my specialties is in ultrasonography, and I have the joy of getting to teach students in the IE and physicians as well how to use ultrasound, which is a lot of fun. And so here's one of my fellows, Ev, who's just great. And so it's a lot of fun to get to do those things. And then I also teach ER courses, medical genetics as well at the local universities. And as Ray said, I do ultra marathons as well. Have any of you guys heard of the Spartan race? Pretty fun. My understanding is, Ray, you'll be joining me in January on one of those, yes? So that will be a lot of fun. So anyways, hearing my understanding is the topic of today is thinking through applying for your clinical year, for jobs in your clinical year. And so I was thinking a lot about this, about how do I, set you guys up for success, right? And so one of the things I tell my students a lot is once you're in PA school, right, you are no longer in this mindset of, hey, I've got to prove myself to get to the next piece. I've got to get all A's to get to the next piece, right? That's not the concern, right? You're building your career now, guys. You are in that mindset now. And so you're joining a very select and special group of people, right? I think sometimes there's this air that there's so many of us, right? But there's really not that many, right? And so in thinking about this, I wanted to frame this as this is your journey, guys. This is your journey that you're going through. And so I want to hopefully kind of show you some of the pitfalls and some of the things to look out for, as well as the things that you can do proactively to succeed in your clinical year so that you get those job offers, not just applying for the jobs, but the job offer piece, which you can absolutely do. And so over here, I've got 5 points to this little journey here. Being prepared is preparing to succeed, starting off on the right foot, making friends along the way, choosing the right path, and of course, be aware of that dragon's gold that might try to tempt you. And so I love Lord of the Rings, and so you might recognize this background here. This is Frodo and Sam just starting their journey these little hobbits starting from humble beginnings and achieving great things. And so, and for some of you, that might be your story, and that's a beautiful thing. And so I want to kind of use this imagery in helping you think in your own journeys, how you can apply these principles. So the first one is preparing to succeed. So I know we're talking about primarily applying for jobs, but are you guys primarily in your clinical years, my understanding, or about to start your clinical year, one of the two? And so one of the things you want to keep in mind when you start your clinical year, right, is it's difficult, just as didactic year is difficult, but for different reasons, right? Didactic year is very difficult because you're in a pressure cooker, right? Every day you are trying to drink from that fire hose. You are trying to stay afloat with all this information coming at you, right? Clinical year is a little bit different. Clinical year, you're out there and you're trying to do the thing that you have worked your whole life to do. And you're having so much fun. You're getting all this experience. You're like, oh my gosh, I'm getting to actually touch patients and apply the things I've learned, right? And so the difficulty in the clinical year is staying focused on the end goal, right? So clinical year is great. Rotations are wonderful. You're going to get all these great experiences out there. You're going to learn so many great things, but you need to focus on two things, okay? You need to make sure you're focused on two things. One is passing the PANCE, right? And then obviously graduating from your program, right? That is the biggest thing. So yes, have fun in rotations. Yes, do that. But make sure you are setting yourself up to succeed in your second year. Make sure you have put together a good study plan. Make sure you have put together a study plan from day one where you're preparing for the PANCE. Do not wait, which most students, this is the case. They wait until about good students wait until about 3 months until they start really focusing on the PANCE. And I'm going to tell you guys this now. Start now, team. Start now. Make sure you're preparing. And so what does this do for you? Not only does this help you succeed in your clinical year for passing your boards and passing your clinical year, but it will free up time for you to actually start engaging in your clinical year in career building, right? And so that's really important because you can't do that if you're so stressed and pulling your hair out towards the end, trying to focus on the PANCE. Does that make sense, team? And so that's what I mean by preparing to succeed. Make sure you have a study plan. Make sure you've put out your schedule on what you need to accomplish and what you need to do, right, throughout the year. Because really, truthfully, you start getting your job offers around that last 6 months. And so that's what I mean. Prepare now so that when you're in your prime in your clinical year out there in your last 3 to 6 months, you are able to entertain those job offers. You're able to have the brain space to perform on that rotation you want to perform on. Another part I'd mention too is if you have any control over your rotations, I often recommend to students to pick the rotations that they are most interested in, perform in wanting to do their job in, do those at the last 3 months. Because the nature of the beast, you know, for people like me who are experienced in having students, who are preceptors for students, we get it. We understand that when you're on your first rotation, you don't know up from down, left from right. That's okay. There's nothing wrong with that. That's the expectation. But not everybody appreciates that, right? And so that's where I say put the ball in your court. Start off with the rotations that maybe you're not as interested in, right? Get your feet wet, get into your flow of things, figure out yourself on what that's going to look out for the year, and then schedule your ones at the end, right? So the ones you're like, hey, I really want to work at this location, or I really want to do an SGR at this location because this is where I want to work. Make that your last few rotations. That would be my big recommendation there, because then you can really shine and show them what you got. So that's point one. Point two, step in this journey is starting off on the right foot, right? Each rotation is an opportunity for your career, right? This is where you get your layers of rec, guys. So make sure when you show up to rotation, you're coming to play, right? Think of each of those rotations as a job interview, right? I know it may still be in the student mindset, right? And I want to break that for you. You're in career mindset now, team. That's where you're at. Every shake and move you do from now on is about your career. You are professionals now, right? And so when you show up to rotation, and hear me out, even if you don't like it, right? Even if it's a rotation that you're like, I'm an ER guy. I love ER. Not everybody loves ER. Even if you show up, you're like, man, I hate ER. This is not what I want to do. That's okay. But show up to play, right? Be involved. Make sure you're active. Make sure you're kind. Make sure you're professional in all of your rotations. That's really important because each of these are basically a job interview. And the medical field is very small. It's very small and we all talk, right? And so that's an important piece. I've had students who apply to our fellowship. And of course, if you have questions about fellowship, postgraduate training, doctorate stuff, be happy to answer questions at the end as well. But I've had people apply, and I've had a former classmate of mine or a former student of mine who will call me up and say, hey, Dr. Zapata, I heard this person wants to do your thing. This is what they did at my rotation. Ooh, that's kind of a red flag, right? And so something to think about, right? Small world, everybody talks. But the converse is also true, guys. If you make friends along the way, they will stick their neck out for you. If you show up to play, even if it's in a specialty you don't like, guess what? They may know the person that you are applying for that job for and say, hey, guess what? Sarah did a great job on rotation. I know she doesn't want to do OBGYN, but she's going to be great for your internal med team, right? Get what I'm saying? So that's really important. So treat each of your rotations as a job opportunity for you. And also where you get your letters of rec, as I said before, right? Make sure you're seeking out mentors and being involved that you think would be a good letter of rec person for you. And make sure you're asking them early and giving them time to prepare it for you. One of the things that I ask my students to do if they're asking me for a letter of rec is say, hey, I really want to make sure I'm representing you well. So I generally will ask students things like, can you send me your transcripts if you're comfortable with that? And then just give me a summary of what this job is that you're applying for and what do you believe your strengths are for this job. And then I take that and I marry that with my experience of the student to try to give them the best letter of rec possible. And so hard for me to do that if it's 2 days before, right? So make sure if you're asking for letter of recs and those sorts of things, it's pretty generously in advance. Last piece here, or the last two pieces here. So the fourth part of the journey is picking the right path. Okay. And so one of the really cool things about being a PA is you have lateral and vertical mobility. You have the ability to go from one specialty to another. As Ray mentioned, I practice in 3 specialties and in education. That's wonderful. And I get to do that as a PA, and you will get to do that. And one of the reasons I do that is because I like to have a broader net of knowledge. I feel personally that my ER experience helps me be a better primary care provider in the correctional facilities. I feel my experience in the correctional facilities helps me be a better advocate when I'm in the ER. I feel my experience in the in psychiatry helps me in both of those other specialties. And so what I'm saying is when you're trying to decide where you're going to go, right? Think through what you want your future to look like, right? So there's lots of specialties you can go to. If you go to a specialty right away, right, instead of going to a primary care or internal medicine, one of these broader ones, right, you may lose some of those chops, right? So consider having maybe an urgent care job with that too, to keep your chops up if that interests you. I don't want to dissuade you if you're very passionate about orthopedics or whatever, absolutely go down that path, right? If that is your passion, but do consider that, right? You've worked very hard to get your foundational knowledge through PA school, right? So it is helpful to know and build a foundation that is solid. So that's the discussion of specialty versus no specialty. Other pieces of choosing the right path. Do you do postgraduate training or do you not do postgraduate training? This is a big discussion, right? And so I'm obviously biased, and I admit my bias. I love post-specialty training. I did it, I'm involved in it, and I teach in it, right? And so I very much believe in it, right? And so some of the benefits, right, in doing a fellowship or a postgraduate training program is that you get the opportunity, right, to essentially focus on your medicine. You have to understand that if you're applying for a job right out of school, right, and you're expecting to make a full salary or full pay, there are things that have to come into consideration, right? When you're starting, you're going to be green as grass, right? You're not going to know everything. That's okay. You're new. You should expect that, right? But, right, that comes with risks. And if I'm a good lead PA and I'm trying to hire you, I want to protect you, right? You know, maybe I'm hiring Ray. Ray, you're a great PA. I see a great future in you, but I don't want to put you in a situation when you're going to be outside of your comfort zone. And so what am I going to do? I'm going to put you in fast track. I'm going to put you in these areas that are going to theoretically protect you, right? But the problem with that is you never really get the opportunity to grow, because you need to see enough patients in order to pay for your salary. Does that make sense? So there's a balance issue there. And so if you want to do, say, for example, a specialty, or you want to get that additional training, you might want to consider a fellowship. That's why things like orthopedic fellowships, ER fellowships, now at Arrowhead, we also have a general surgery fellowship as well, and an OBGYN fellowship are so popular, because it affords you the opportunity in order to gain those skills that you may have to take years to obtain. So that's one of the things to consider. Do you want to do a fellowship or not? And if that's the case, then you want to go back and think about, how am I going to prepare for that? I'll give you an example. A shining student of mine, currently a fellow right now, she did 3 ER rotations. Totally knocked it out of the park, got amazing layers of rec. She's one of our fellows now. She set herself up because she wanted to do that. That's what she wanted to do, right? And so you have to think through those things, right? What is that going to look like for you? And so we can talk more specifics on that. Be happy to talk more about fellowship stuff as well, but just want to give you that general thought, things that you want to think about with your path. And then finally, and I think this is probably one of the most important things in my mind, is beware dragons, right? So beware of dragon's gold, guys. So when you start getting job offers, or when you start applying, right? Again, you're professionals now. You are not only being interviewed or looking for jobs, you are interviewing the job, right? And I want you guys to have that mindset. Remember, you have worked very hard to get to this point in your life, right? Think about all the years that you've put into your education. And that's not just PA school. That's including all of your undergrad, your post-bac, and PA school. You guys have put in a lot of work. And so one of the things that really, that I feel very passionate about is when my student goes out there and they accept a job offer that has a shiny dollar sign on it, and then they call me 1 or 2 months later saying, Dr. Z, I don't know what to do. I'm overwhelmed. I feel like I'm being very unsafe in my patient care. I'm being asked to do things I'm uncomfortable with, right? That breaks my heart, because that means that student is being put in a situation that is, one, dangerous for them, right? Because they could lose their license if something bad happens, right? And two, it's not conducive to their growth. They are not being given the opportunity to grow into the type of provider they want to be, right? And so that's one of the big things that over the years I've noticed that I want to impart to you guys, that I impart to many of my students, is don't be razzle-dazzled by the shiny gold, right? You guys have worked hard. You will make a good paycheck at the end of this, right? And that will come with time. But when you first start, make sure you pick a job in an environment that is going to train you well and is going to treat you fairly. Does that make sense? So even if the job is offering you a big paycheck, ask questions like, okay, what do the work hours look like? What does my onboard and training look like? What does the availability of my attending physician look like? What does that collaborative nature look like? And I would suggest that it is better to take the lower paying job in your first couple of years if that means you are going to get really good training. If you are going to get a attending physician Or if you do a fellowship, like our fellowship, that you're going to get that help, that training that you need, that additional training so that you feel comfortable providing care wherever you're at. I would say that is more important than it is to start off and run the risk of making a mistake and possibly losing your license, right? My viewpoint is you have worked way too hard to get to where you're at. Take a year. That's why fellowships exist, for example, right? Take a year, take 2 years at that primary care job or internal medicine or wherever, where you're going to get that good training. And then if you're really comfortable, you can take that shiny job after that because you've been prepared to handle that. So that to me has been the biggest thing on my heart in the recent years, kind of seeing that with students and getting those phone calls. And I don't want that to happen to you. And so that's a big piece to think about. And then the last piece here is don't forget to have fun, guys, right? Your clinical year is a lot of fun. Yes, I talked about a lot about, all right, show up to clinicals, be ready like it's a job interview, very serious, right? Have fun, guys. You know, again, I'm biased as a PA and a practicing medicine, but I absolutely love it. You know, it is the best job in the world. You know, you're going to join something that is absolutely exhilarating. It is unique. You are being trusted with people's lives, and we are getting the opportunity to truly have sacred moments with people. And so protect that, right? Make the right choice. Make sure you set yourself for success in the second year. Pick your right path and don't pay attention to the dragon's gold, right? Focus on you and your own personal growth in those times. All right. And so wanted to get to the question piece for you guys, because I'm sure you guys have lots of questions. So thank you for your time. That was when it kind of wanted to walk you through the journey and thinking through your second year, because it's not just applying for jobs. You guys are professionals. You're going to get job offers, and there's going to be plenty out there for you as long as you set yourself up for the journey appropriately. Cool? All right, guys. And I have my contact information here if you want. You guys are welcome to email me as well.
Okay, perfect. Thank you. So we'll start the Q&A session. So if anyone wants to like raise a little hand on there, we can ask through there. I personally have a question for you. So like as a person that introduces PA students into their fellowship program, or like you're a lead PA, you're interviewing PAs, like what is one thing that you are looking for as an interviewer?
Absolutely. That is a fantastic question. And so what I tell a lot of students is when you show up for interview or your application. So for example, if you're doing a fellowship, you are going to have to go through an application process. And one of the mistakes I see a lot is students will write essays or letters of intent, right? And you guys have been students for most of your life, right? So it's completely understandable, where you're encouraged to talk about things from your perspective. Things like, this is how I feel about my journey. This is how I feel about, and those are all valid things, right? But remember, you're now a professional communicating to another professional why you would be a good part of the team, right? And so one of the things I look for is, hey, have you thought about what you're going to offer the team? What is it about Sarah that is going to benefit this team? Why do I want Sarah on the team, right? What is she bringing to the table, right? And so one of the mistakes I see a lot of students will not do that. And I've had plenty of students that I've mentored over the years. I'm like, you're phenomenal. Like, why are you not writing this stuff? Like, you have all these great qualities. Why are you not talking about your leadership? Why are you not talking about what you bring to the table? And so that's one big one, right? Is because what that tells me is you're introspective. You thought about, right, your qualities as an individual and what you bring to the table. That tells me I know what I can ask of you, right? So that's a big piece. Other pieces that I look for in applicants is, does this seem like someone that is going to want to engage or someone that's going to disengage, right? I want people on my team that love what they do, right? And that's nothing against people that are looking for a job. That's just more of, hey, this is maybe not the specialty for you. If you don't wake up in the morning and are excited to serve in an underserved population group in order to to get in there and be involved and engage in a diverse team. Like maybe that's not for you, and that's okay. There's nothing wrong with that. I have colleagues that they did ER for a couple months and said, I can't stand this. That's fine. I go to ER and I love it. It's every day. So there's nothing wrong with that. But the point being, right, is do you seem like someone that's going to be engaged every day? And do you seem like someone that wants this? That's a big piece. The other one is, does my team like you, right? We usually will do panel interviews for our applicants. And so that's big for me, because do you seem like someone that's going to be fun to work with, right? So that's another big part of our team is we look for people like, hey, they look like a lot of fun. They look like they have a good sense of humor, that they don't take themselves so seriously, right? That they're okay with being humble about that. You need to have that in the ER, because you have to imagine, if I'm going to be sitting in a pod with you for 12 hours, right? If you're a stick in the mud, right? That's going to be a tough 12 hours, right? It's going to be a tough 12 hours, right? And so those are things that I would think about, right? Are you passionate about this field that you're applying for? And so a lot of this, what I want you to hear is not, these are the things that you need to change about yourself, right? I don't want you to hear that. What I want you to hear is be introspective. Does this field, when you think about ER or psychiatry or whatever, does this make you excited? Is this something that you're like, I want to do this, right? If you're just applying because you think it would be interesting, but it's not something you're passionate about, you don't really want to do the 12-hour shift, right? Then maybe that's not the job for you, right? And again, nothing wrong with that. And so a lot of this starts, I think, at the applicant thinking about the job before they apply for it. And so when you do, those are the things we look for. Are you hardworking? Do you look like you're going to be willing to put in the work? Do you seem like someone that's going to be fun to work with, right? That's going to be engaging and doesn't take themselves so seriously. And then finally, the last part is, are you coachable? Guys, that is the biggest thing. Are you coachable, right? Because here, being in a teaching position at multiple levels. So I teach at the graduate level, I teach at the postgraduate level, and then I essentially act as like a mini attending in the ER, right? And so I manage the residents, and I manage the physician residents and the PAs. Residents and the new PAs. And so I kind of oversee all of that. And so one of the biggest things is like that I tell my colleagues is, I'm looking out for you, right? That's my job, right? I'm seeing my own patients, but I'm also here for you. And if I'm working with you, and let's say we're doing a central line together, or we're doing a deep brachial access with ultrasound guidance, or whatever, right? And if I tell you, okay, you have to stop, right? Then you need to trust me and you have to stop, right? But if you're stubborn and you're not coachable and you're not going to listen, that is putting not just you in danger, but the patient in danger, right? And I won't hesitate to pull you out. I've only had to do this a couple of times, right? With fellows, but that's one of the biggest things, where you got to be coachable, right? Because, and the way to get yourself into that position is to realize that, guys, there's so much we don't know. There's so much in medicine. And I want you to hear me say this, that's okay. You don't need to know everything. I don't know everything. I had this conversation with my fellows yesterday when I was teaching them about chest tubes and stuff, right? I know the boundaries of my knowledge, right? And I know I need to continue to grow in those areas, but I know those boundaries. And that's one of the most important skill sets that you guys can learn as a clinician is where are my boundaries of knowledge, right? Because when you butt up against that, you have to be okay with saying, I don't know. That's all right. And then then what you're supposed to do is reach out to a senior provider like myself, or your attending physician, or the specialist. And hear me out, right? Through undergrad, you've probably been conditioned to not want to be wrong in anything, right? You've been conditioned to get 100% or A's on everything. When you're in your interview for PA school, hey, I'm perfect. I have nothing wrong. You want me as an applicant because I'm going to get 100% on the pants, right? Right? Am I wrong? Right? And so sound familiar? Some of the inner talk here. But the reality is, again, you're professionals now, you no longer have to prove yourself. Here's the reality. What is the worst thing that can happen? If you're on shift and you don't know something, right? The worst thing that can happen is you ask me or you ask the specialist and they say, hey, you should know this, right? You should probably know this, but this is, we're gonna do. Or maybe they're mean, maybe they woke up on the wrong side of the bed or something, and they say a couple rude words, but they give you your answer. And guess what? You provided good patient care because you made sure nothing was wrong. What's the worst that can happen on the other end? If you say, oh, I should know this, I'm just gonna, I think this is it, right? I think this is it. And you do it. What happens? Patient could die, right? And so my point being is nothing really bad happens except a strike to our ego. And I'm going to say this now. My opinion is there should be no ego in medicine. There should be no ego in medicine, period, right? And that's hard because even though you might be hearing this and saying, yes, this is what I want to be about. I don't want to have any ego in this. I don't want to have any pride. We've all been conditioned, right? Through undergrad and through our academic career to build this ego. And so it takes some time. And so I would say that's the other piece too, is be coachable. And how you get yourself into that heart position is by humbling yourself and reminding yourself, hey, there's so much I don't know, and that is okay. Because the way for me to become good at what I do is being willing to be the fool. There's a great quote, something along the lines of, if you want to be the master, you have to first be willing to be the fool, right? And so what does that look? So I'm saying a lot of kind of general things here. And so how do you specifically do that, right? When you're on rotations right now, you're the first one to try for that presentation. Even if you're like, man, I got that wrong, right? That's okay. Guess what? You'll never forget that. You'll never forget that. I promise you, you do that over and over and over again in your career, before you know it, you'll be looking around, people will be looking at you like, dude, what do I do? And you're like, how did I become the adult in the room? Right? And so that will happen quicker for you, right? And you won't put yourself in situations that are dangerous. So does that answer your question? A few points there. Awesome. Cool. Ray, you had a question?
Yeah, so my question goes more, so for those who are doing clinical rotations, let's say in California, but they want to apply, they are thinking of moving to another state, and obviously that kind of puts a certain amount of barriers. How do you tell those students to approach looking for a job out of state as soon as possible, or being able, without being able to see the environment, without being able to networking as much? Like, what's your advice for those students?
Great question. Try to do an SGR. Right? So most of you guys are probably in your first semester of rotations, likely. I know, Ray, you start, I believe, in the spring, but try to do an SGR. An SGR is a student-generated rotation. One, your school will love you for that, because schools always want more rotation sites. And so reach out to where you want to practice, right? So if, for example, you want to practice in, let's say, Arizona, right? You have family out there, you want to move back, maybe that's what that looks like, right? So start calling those areas out there. If you have your tech experience out there, or you have experience out there, maybe call those offices, right? See if you can get an SGR, right, set up for them out in that area that you want to practice. That would probably be the best way to go about it, particularly in your clinical year. If that's not possible, another thing you can do, right, is you can just start applying for jobs in that area. Now, it's okay to start applying I'd say about 6 months into your second year. That's okay, with the expectation that you're going to pass your boards. So most places are like, okay, well, how far are you out from your boards? Well, I'm only 3 months. Okay, we'll take the gamble on it if we like you, right? That's how it is with most fellowships, right? We do, for example, our application process starts in January, and we finish and select our fellows in July. So that's well before most places have finished their programs, right? And so that's okay, right? So I would start looking at those things about 6 months in and start putting in those applications. And then it also doesn't hurt to email whoever that lead PA is, or that attending that you want to work at. Email them. Don't email them like every day. Don't do that. But once a week is okay. Once a week is okay to follow up with them or to give them a call. But don't do every day. There's a balance there. Every day is a little too much. So yeah, that would be my biggest advice to that for out of state is try to get an SGR. That's the best way to do it. And then if you can't do that, it's okay to start applying about 6 months in, and then cold call or send them an email, whoever that lead is, to introduce yourself, essentially. Other things too is you could also, and here's a consideration. For example, I work at Vituity for Vituity. So Vituity is a major staffing company in the whole US, right? Another thing you could do, right, is if you get involved with a major company like that, they most likely will have a site for you in wherever you're looking to practice, right? So for example, right, one of the things that happens in our fellowship a lot is students will come from all over the country. I have 2 local students and 2 students from out of state in this current group. And so they'll come here to do the fellowship. Our fellowship at Arrowhead is about 14 months. And then after that, you're a Vituity employee, which means now instead of applying as someone as an outside entity, you're now applying as an inside entity. And on top of that, you also have a fellowship that is basically a rubber stamp saying, you know your stuff, right? And so often what will happen is our fellows will get scalped. They'll get grabbed up. So people will look for them, right? And so that is something that is a consideration, right? So if you want to look for ways to get to where you want to be, right, there's also ways locally to do that. If you want to become a specialist in ortho or a specialist in surgery or whatever, we have that opportunity here. If that's what you want, and then that can connect you to a bigger company, which makes it a lot easier for you to transfer, essentially. Because the hardest part, and part of this is me speaking from an ER perspective, that it is tough to get an ER job. And it is tough to get, like, if you want to do ortho, same thing, ortho job. And so a good avenue to do that is a fellowship, or at least get in somewhere with a big company and start there, and then you can make that transfer. Sometimes though we suck you in, and then we keep you for, like my friend Heather kept her for 10 years, and then she finally moved to Washington. But point being, you have lots of avenues to achieve this. Great question, Ray.
So, Dr. Zapata, you kind of answered a lot of my questions, actually, just speaking with Ray and Sarah. So thank you so much for that. But I'm a didactic care student at the moment. So I was kind of wondering, what was the timeline between graduating PA school and starting your fellowship? And depending on the specialty from your experience, not just with ER and for all the other specialties that you've seen, is it better to kind of graduate, kind of work a little bit depending on that specialty within that specialty, and then get onto a fellowship, or vice versa?
So your question is the process of applying for fellowship, the timing of it, and then what would be best, or perhaps maybe what you're asking is it beneficial to get other experience beforehand? Is that correct? Am I understanding that right? Gotcha. Okay.
Yes,
so
if it's beneficial.
Gotcha. Great question. Fantastic question. So application starts in January every year, at least for our fellowship, right? One of the best resources you can look at is you can go to APPAP. And so what this has is it has a list of all the PA fellowships in the country that you can look at. And so if you're looking, for example, to practice out of state or practice in state in California, right, that might look different for you. I also have a website where I list those links for you that I can send to Ray at some point, and that he can send that to you guys to look at. On my little mini website, it's purely just, I built that because of it's most questions I've gotten from students over the years. So it has things like community service, scholarships, which in didactic year and clinical year, you guys still have opportunities for scholarships. And I always tell my students, I'll tell everyone here too, apply. You never know, right? And some of these, because some of my friends are on the board and they're like, we only got like 30 applications, right? I'm like, go for it, guys. So anyways, so I can send that to you as well. But anyways, so application for us, just as an example, is January. We pick in July, right? And time to start is we don't do rolling. We try to start everybody at the same time is what we try to do. So we think there's value in creating cohorts so you guys can have a group together, you can congeal together, you can have camaraderie. And we also have 2 months of overlap with the current fellows, because everyone knows, if dad tells you something, right, you might hear it. But if brother or sister tells you something, then it's probably gonna be a little more effective, right? Right. So we like to have that. They're gonna tell you how it really is, right? And so we like to have that, right? And so our start point is on October, right? As a general kind of broad way to answer your question, onboarding generally takes about 3 months, team. So have that expectation. Once you accept the job offer and you start credentialing, it takes about 3 months to get all of that done, right? And so keep that in mind. For us, we solve that we assume you're probably going to finish in July or so, or August. You're going to take your boards then, and we aim to try to push your application through by the beginning of October. So you're ready to start day 1, October 1st. And so that's why we send our acceptance letters in July, so we have all that time to start your onboarding even before you finish boards. So that's why we do what we do, essentially, because you have to keep in mind that 3-month period. Now, to answer your question about having prior experience or not, does that benefit? Totally depends. A majority of our fellows are actually new grads. So they come right out and they do the fellowship. That was my experience. The reason I did that was I figured, well, I'm already used to the top ramen life, and I know if I take this other job offer, because I was given other job offers. Hey, if I take this other job offer in internal med and I do that for a few years, I don't know if I'm going to be able to convince myself to stay on that grind mindset, right? And so that's a reality. It's something you have to consider. And I'll tell you now that I'm a little bit older, I'm very glad I did that in my 20s. Very glad I did that, because it gets harder as we get older. It gets harder to do the same stuff, and it's just reality. We get wiser, so I think I'm way more efficient than I was, but I'm very glad I did that in my early career. And so there is no real kind of, hey, it's 100% if you do this, it's not if you do that. So we look at both, right? So obviously, if you have some experience, that is going to be beneficial, right? So if you've gone and you've done a year of, say, primary care, or like my fellow who's in that picture, Eb, right? He did 10 years of primary care and he really wanted to do ER, right? Ed was one of our fellows. We had another fellow about 5-6 years ago now, who he was in surgery. He was in surgery for 5 years, and then he hyper specialized, and he's like, hey, I want to do ER. I want to do something more broad, but I haven't used a stethoscope in a while, right? So I don't really know how to do this, right? And so he did the fellowship in order to prepare and make that transition, right? And he's excellent, absolutely excellent, right? And so really, both are beneficial, right? I will say this, because I don't think this is what you're asking. I think you're perhaps asking, hey, would it benefit me to do this? I'd say, yes, everything benefits, right? Everything is good. But don't feel like someone else is going to have an advantage over you just because you're applying and you don't have that. We absolutely look at everybody individually, right? So we don't look at it in that way. But I will say this, to answer maybe a broader topic, is if you're waiting, for example, that perfect job, right? Let's say you want that perfect job, right? I would say don't continue to not work, right? And wait a year and a half and not start doing something. Go and take that primary care job. Go and take internal med. Go and take whatever. If there's something out there, right, that is going to help you grow. Because again, remember, you're growing. Whatever specialty you pick, whether it's primary care, internal med, or ER, you're growing in that job. You're getting better at medicine, right? Just make sure you pick a team that is going to invest in you, right? Don't pick a team that's just going to use you as labor to just move patients and have a toxic environment, right? Pick a team that's going to invest in you, that's going to help you grow, right? And if you do that for 3 to 6 months, and then you decide to transition to the fellowship, there's nothing wrong with that, right? There's nothing wrong with that. What I will say though, is if you're a student and you graduate, you pass the boards, and you're waiting for that perfect cardiothoracic surgery job and you have no fellowship training, nothing, and you're waiting a year, here's what it looks like as someone who interviews people, right? This is what this looks like as we're going through tons of phenomenal applicants, great people, right? That we're excited to interview. If I see someone that hasn't worked for a year, 2 years, right? And it's getting a little while, I'm starting to ask, are there some red flags here? Has this individual, interviewed other places and been shot down a million times? Like, why is that, right? And then you have to think, do I want to take the gamble on this individual versus, hey, I've got, this other applicant here who is really excited, has no work experience, right? But really wants to do the fellowship and can tell that she's telling me that she's motivated, she wants to do this, she's coachable. I'm going to invite, this individual to the interview, right? You see what I'm saying? So you have to always consider, how does that appear, right, to the person who's looking at these applicants? Does that answer your question?
Yes, thank you so much.
Fantastic. One thing that just reminded me that I want to tell you guys that would hopefully be helpful career advice is, whenever you're drafting your CV, right, when you're applying, or your letter of intent, really make sure your point gets across, right? It is better for you to, and this is my recommendation, have a short CV, keep it to 2 pages max, right? Even if you've done a million things, right? Keep it to 2 pages, right? The reason being is we go through dozens, right, of applicants, dozens of pages, right? And, interviewers are busy, lead PAs were busy. We got a lot of stuff going on, right? And so make sure whatever you want me to see is on that first page. Make sure I see it, right? And so what's that mean? Put your most relevant training, your most relevant selling pieces at the beginning, right in my face, so I can't miss it, right? Don't put the things that maybe don't super apply just because you're following a format that you got online, right? I see this a lot. Students will get formats that look nice and pretty, but they don't put their strengths, right, at the top. The strengths are somewhere on page 4. And just be honest, we're not going to really look at page 4, right? If I've got 100, CVs I've got to read, probably not going to do that. I'm going to go through, I'm going to read through your first page, and I'm going to start formulating what I think, right? So make sure you set yourself up that way well. Put your best attributes, your experience, what you want the interviewer to see on the front page, and try to keep your CV to 2 pages.
Okay, I have one question as well, because you did both the DMS program and also a fellowship. And I know you're going to be like a little biased in both, but would you recommend it for people? Like, my interest is in the ER, but I don't know if I want to take the pay cut before doing ER, but also, like, how realistic is it for me to get an ER job without a residency?
That's a fantastic question. And so I absolutely admit my bias, because I did the fellowship, I found it beneficial, and I'm still involved in it. So obviously that's kind of where I stand. And then number 2, I think you're asking about the doctorate as well, correct? And so I'll answer the fellowship part first. This goes back to, what do you want, Sarah? What do you want out of your career, right? For example, I just was talking to a mentee of mine about a couple weeks ago, and he was trying to decide what he wanted to do, on where he wanted to work, what this looked like. And we had a great conversation. And one of the things we talked about is, what do you want to do as a PA? Like, that's what you want to ask, right? Do you want to do things like intubations, central lines, critical care stuff? Do you want to do that heavy lifting type of things? Is that something that interests you, right? If that is something that interests you, then I highly recommend doing a fellowship, because it's going to be difficult. One, because of the systems issues that we kind of touched on in the presentation, of, if I'm hiring you straight out of school and I like you, I'm not going to put you in a position, if I'm a good leader for you, that's going to put you in danger, nor the patient. That's why, for example, fast track exists, because we're trying to funnel the least acuity, lowest acuity patients into the fast track. Now, for anyone who's practicing that, you understand that it's not always, right? Sometimes those really dangerous ones slip through, right? And so there's some concern there with that, but we do the best we can system-wise to do that. That's why that happens, right? And if that's happening, you're in an environment that you're not really given the opportunity to grow, right? Unless you're really fortunate and you have providers that will go out of their way to help you with that. But most facilities are not developed that way. You have the high acuity and you have the fast track. And the high acuity, they've got their own patients to manage. And so you may be fortunate if they come and pull you out of that to do that, right? And so it may be very difficult to get that higher level of understanding, that higher level of procedural knowledge, etc., right? But if you're completely okay with that, if you're like, I'm totally fine seeing fast track patients, in fact, I don't want to do central lines, I don't want to do any of that, right? Then you don't need to do a fellowship. There's no need to do that. Other than with the ER particularly, or with ortho, for example, it does give you a leg up because it is more difficult to get in, essentially. So that's what you have to weigh there. Now, if you want to do central lines, you want to do higher level care, if you want to get to a position, kind of like myself and my other colleagues are, where we're trusted to be able to basically manage not just PAs, but also look after the physician residents and help them too, you have to do those things. One of the biggest benefits, I think, for me with the fellowship was I earned a lot of respect with my physician colleagues, because here's the thing, right? We do 2 years of PA school, and then you can go into practice. Physicians do 4 years of school, and then they have to 3 years minimum of residency, right? And so, and I'll tell you this now, and again, I'm biased because this is my experience, but I believe there's a very good reason that residency exists. There's a very good reason. And so take that into account, right? And when your physician colleagues look at you and say, they decided to voluntarily do this thing that is not required, but because they wanted to be better at their craft so they could provide better patient care, that earns my respect, right? And so that is something that I have noticed, is I feel I get a lot of respect from physicians for doing that, because it isn't required as PA. It's something that's extra, and it's something I wanted to do, that I chose to do because I really wanted to be the best version of myself. I really wanted to be the best possible PA I could be. And I feel that it helped me achieve that, right? And so that's what you have to ask, right? And my mentee, he was like, I'm totally fine doing toenails, all that stuff. I'm like, dude, then you don't need to do the fellowship. There's nothing wrong with that. There's literally nothing wrong with that. It's you picking what you want out of it. Now, when we think about the financial cost, right, which is something that's definitely a piece of consideration. So you have to consider, right, if you are a new PA, right, generally speaking, the first year, the company is going to lose money on you, right? They're going to lose money because you're not seeing patients as fast, which is why they put you in fast track, and then they push you to see more patients, right? Because you need to see enough patients to justify your pay, right? If you're not, then you're out. I'm getting someone new, which is why generally they don't always hire new PAs. They'll want you to have at least 1 or 2 years of experience somewhere else, and they'll want to see your numbers to make sure you see enough patients to justify your pay, right? And so again, that's a financial drive as to why, right, you're put into fast track versus these high acuity things. The reason you have a pay cut in a fellowship is because it accounts for all those issues we've been talking about, right? You have a pay cut because you can essentially look at that as paying for your education, essentially. So it's almost like you're getting more education, except you're still getting paid, right? That's what a residency is, essentially. And so you're given the opportunity in a protected environment where you have every single case chiefed by your senior provider. We look at it, we make sure you're good. We also all have the understanding that we're going to help you get those procedures when those come up. We're going to help you learn those things. We're going to train those for you. And so that's the teaching facility environment. And so with that, right, there has to be a pay cut to justify that. because that frees up, for example, the attending physician to spend time and help you. At other facilities, right, that aren't teaching hospitals, that attending physician is seeing their own 30 patients. So they don't really have time to help you with that stuff, right? So that's something to think about with that. And that's why there's that pay difference there. Now, the doctorate piece, right? So the doctorate piece, I would recommend the doctorate if you're interested in leadership and you're interested in research. Now, I want to mention this. This is important. I thought the doctorate was very useful. I thought it was great, phenomenal. I went to Lynchburg DMSc, and so learned a lot about healthcare law, which really helped me understand my role way better. And so that, for just that, those courses alone, I thought it was worth it. Helped me understand, because we don't do that in PA school. You're focused so much on just getting the medicine down, right, that you don't have time for things like research. You don't have time for things like leadership. You don't have time for things like legal, which, guys, I'll tell you, legal is the playground we play in. There's all these, you will hear lots of theories through PA school and didactic year and through clinical year and in your practice. You will hear lots of theories, but I'll tell you this, those theories don't mean anything if they do not play within the playground of legal, which conversely, if you want to see these theories that some of them are really great, right, on making a positive impact in our society, our communities, then you need to change the legal, right? Don't forget that. If the only time you get in trouble is if you go outside the playground, and that's not legal playground. So anyways, that's really important. But remember, DMSCs and fellowships are not all the same. They are not all the same, right? So that's why, and thank you, Sarah, for posting the APPAP on there. I see in the chat. So when you guys look at that, make sure, again, you are interviewing them. You look through what they're offering you. If you're going to accept the fellowship, they better not be treating you like like you are just cheap labor. That better not be the environment. You should absolutely expect to have a fellowship that is going to push you very hard for the time that you were there. They're going to have a robust didactic component and a robust clinical component. They better have that. If they are not doing that for you and offering CMEs as part of the package and offering this to you, then it is not worth your time, because you will see things like 3 months of a fellowship, right? Or 6 months fellowship. I'll tell you now, that's not enough time for you to grow, right? If you're going to do a fellowship, and it better be worth its salt. So around 12 months to 14 months, I think is a good, obviously I'm biased, that's the length of ours, but point being is undergrilling part, it better be worth your time. So investigate it, ask lots of questions, talk to fellowship graduates, ask, right? What did your experience look like? What was your didactic experience? Are there lectures? What do those lectures look like? What does your workflow look like? Are you just in triage all the time, or are you getting to do these better experiences? Ask things like, what does the next steps look like once you graduate? Do you have opportunities, or are you only offered to work in triage afterwards, right? What does that look like? So those are really important questions that, again, you're professionals, you have to make sure you advocate for yourself too in here. Really important. Does that answer your question, Sarah? So yeah, so long story short, for both of them, they have specific, just like medications, right, team? Specific indications and considerations, right? If you want to do high-level care, specialty stuff, a fellowship is wonderful. If you're not interested in that, and again, there's nothing wrong with that. I don't want you to hear that like that's something bad. Absolutely not. We need everyone in every specialty, right? So if you don't want to do that, you don't need a fellowship. DMSc. If you want to do leadership, you want to learn about organizational leadership, you want to be able to be a good lead PA, you want to be able to be involved in academia and education, I think, and understand healthcare law, I think it's wonderful. But again, look at the curriculum, make sure you're getting what's worth your time in those DMSCs.
All right, well, thank you so much for coming and attending and speaking for us and to us about everything. Ray?
I was just wondering, Dr. Zapata, is it okay for me to put your email in the chat just in case some people have more question about the fellowship or DMSc or anything like that?
Absolutely. So yeah, you can put I have lots of emails. So the best one would be the Vituity one. That would be the best one to get a hold of me, because I have one for each of the colleges. So not the ULV one, but the Vituity one, Ray, would be the best one.
Okay, thank you so much, everybody. We're gonna take our 1 hour lunch break. So, and then after that, we'll come back to our panelists. Again, thank you, Dr. Z.
No problem, guys. You guys have a wonderful rest of your weekend.
Thank you so much, Dr. C. Appreciate it.
Thank you.
Thank you.